You know, when you picture a severe burn, your mind probably goes straight to the damage on the skin. But for doctors in those first critical hours, the real life-or-death battle is fought against an enemy you can't even see, a catastrophic collapse happening deep inside the body. This is all about how we fight that ghost in the machine, and it starts with just how massive this challenge really is.
And the stakes, they couldn't be higher. For patients with what are called hypercritical burns, we're talking burns that cover more than half their body, the mortality rate is still tragically high, even in the absolute best, most specialized hospitals in the world.
You see, the thing that often kills the patient isn't the fire itself. It's a devastating internal chain reaction called burn shock. Basically, the body's tiniest blood vessels, think of them as the local delivery routes for every single cell, they just start failing on a massive scale. And when that happens, tissues get starved of oxygen, and that leads directly to cells dying, overwhelming infection, and then, one by one, the organs shutting down.
So here's our game plan for this explainer. First, we're going to really understand the enemy, burn shock. Then, we'll look at why the old way of fighting it was kind of like trying to put out a fire with gasoline. And finally, we'll dive into the modern, super precise strategy that's changing everything, from smarter fluids to literally protecting the body from its own defenses.
Okay, let's start with this silent killer. A huge burn isn't just a skin injury, it's a signal for a system-wide, full-blown red alert. The body's inflammatory response goes into absolute overdrive, and that makes all the blood vessels super leaky. And that right there, that's where the whole cascade of failure really begins. What's so critical to understand is that the organ failure and sepsis that might show up days later, well, their roots are planted right here, in these first few hours. So if you can't fix that collapse of the microcirculation immediately, you're pretty much setting the stage for total disaster down the line. It's the ultimate cause and effect.
All right, so the body is losing tons of fluid through all these leaky vessels. The obvious answer seems simple, right? Just give it more fluid. And for a long time, the approach was to just pump patients full of saline solution as fast as possible. But it turns out this very well-intentioned rescue can go horribly, horribly wrong.
And this right here perfectly captures the doctor's nightmare dilemma. Give too little fluid and the organs don't get enough oxygen and they start to fail. But, and this is the crazy part, give too much fluid and because those vessels are like a garden hose just full of holes, the fluid doesn't stay where it needs to be. It floods all the surrounding tissues, causing massive swelling that damages the lungs and the gut, which also leads to, you guessed it, organ failure. It is a terrifying tightrope walk.
So the very treatment that was designed to save the patient actually becomes a new threat. The tissues, especially in the super delicate lining of the lungs and the gut, they essentially get waterlogged. They are literally drowning from the inside out, all because of that aggressive rescue attempt.
And this realization led to the modern approach, which we can basically call the Goldilocks principle. The goal is no longer to just dump in massive volumes of liquid. Instead, it's all about finding that just right balance, restoring circulation using the absolute minimum amount of fluid you need to get the job done.
So how in the world do they know what's just right? Well, it's all about super precise monitoring. Modern teams are watching key indicators in real time. They're looking for an hourly urine output of about 1 milliliter for every kilogram of body weight. That tells them the kidneys are getting enough blood flow. And they monitor something called central venous pressure, or CVP. The best way to think of it is like a fuel gauge for the entire circulatory system. It tells doctors exactly how much fluid is in the tank so they don't accidentally overfill it.
But finding that just right amount isn't just about turning the tap up or down. As we're about to see, it's also about what's in the IV bag. Just using standard saline isn't good enough anymore. The modern strategy uses a specific cocktail of much smarter fluids, all designed to work together for the biggest effect with the smallest volume.
The first wave of attack is a rapid three-part combination. First up, a dose of hypertonic saline. It's extra salty and acts like a powerful magnet, pulling fluid back into the blood vessels. This is immediately followed by colloids like dextran, which are these big kind of sticky molecules that essentially plug the leaks and keep that fluid right where you want it. And finally, they add sodium bicarbonate to fight off the dangerous buildup of acid in the blood, which always happens during shock.
Now here's why that combination is so smart. The hypertonic solution, it's like a magnet, right? It rapidly yanks all that leaked fluid from the tissues back into the bloodstream. The colloids then act like a net, holding that fluid inside the vessels where it belongs. And a little later, salt-free solutions like glucose are added to give the starving cells some much-needed energy. And while doctors might start with a balanced recipe, the key is that this cocktail is constantly being adjusted, minute by minute, based on exactly what the patient's body is telling them.
But even the absolute perfect fluid strategy isn't enough on its own. Burn shock is a total systems crisis, and that means it requires a total systems defense. The next step is a coordinated attack that goes way beyond just managing fluids. This quote from the source material it's just so powerful, and it's central to understanding this whole approach. During shock, the gut's blood supply gets slashed. Its wall becomes leaky, and that allows bacteria and toxins to just flood into the bloodstream, kicking off sepsis and driving multiple organ failure. So protecting the gut, it's absolutely paramount. So how do they protect it? With a full-on gut defense shield. And this isn't just one thing, it's 4 actions working together. They use targeted antibiotics to wipe out the bad bacteria, special agents to mop up any toxins that manage to get through, probiotics to reinforce the army of good bacteria, and, crucially, they start feeding the patient almost right away. This gives the gut wall the energy it needs to stay strong and keep its defenses up.
And the attack keeps going on other fronts too. They use corticosteroids to calm the body's completely out of control inflammatory alarm system. They give heparin to prevent tiny deadly blood clots from forming in that sluggish circulation. And they flood the system with huge doses of antioxidants, like vitamin C, to neutralize these destructive little molecules called free radicals, which act like shrapnel, making the blood vessels even leakier.
So, what's the result of this incredibly sophisticated, multi-system preventative strategy? Well, the payoff is enormous. And you can actually see it right here in the data. Just take a look at this. This chart shows how much fluid was needed in the first 24 hours. Now, patients on the standard therapy needed about 5.5 milliliters of fluid for every % of their body burned per kilogram. But the group that also got high-dose vitamin C, they only needed 3.0 mLs. That is a nearly 45% reduction in the amount of potentially dangerous excess fluid being pumped into the patient. And this is the ultimate goal. A patient who gets stabilized faster with less fluid is strong enough for surgery sooner. This lets the surgeons get in there and remove the dead, burned tissue, which is just a massive breeding ground for infection, much, much earlier. And that surgery is the final critical piece of the preventative cycle. It stops sepsis before it can ever really take hold. When you look at it all together, this whole approach is really a fundamental shift in thinking. It suggests that in the most critical injuries imaginable, survival might not depend on the biggest, most aggressive treatment, but on a whole complex series of smaller, smarter, and perfectly timed interventions that work together to rescue the body from itself.